My name is Dr. Ne, the medical director of the Richards Clinic. You see, I have taken my time to research and find out why people suffer pain, especially chronic joint pain, for a long time. Many people come to our clinic with 3 years history of chronic joint pain, 4, 5, some more than 10 years. And not as if to say they have not been doing anything to solve this chronic joint pain. But most times, what people do to solve the joint pain are all wrong. And today, I bring to us common mistakes people make concerning chronic joint pain, arthritis in short. Number one, ignoring the chronic pain. At the early stages, the pain might be mild and it allows us to function. We can go out and come in, take painkillers, and it relieves us to move out and come back. Ignoring it means not finding out what the pain is all about. Because many of us think that the pain is the problem. As long as I can cool down the pain, the problem has been cooled down. No, chronic pain specifically is a signal, is a warning sign in our body telling us about potential or actual tissue damage or any problem in the body. That's the signal God has put in our body, so that whenever the pain comes up, we should ask ourselves what is it telling me about. So when you have pain in the joint, it's telling you that the joint is about or is already degenerating. And you have to find out. Because when you find out early and nip it in the bud, you can treat chronic joint pain or arthritis, you can treat it and it can stop and stop permanently. Some of us not only ignoring the joint pain, but we use painkiller to suppress the pain. Just as I said earlier on, because we thought and believed that pain is the issue. So anything I have to do for this pain to go down, I'll feel happy. But the truth of the matter is, you are not solving what is causing that pain. So instead of taking all kinds of painkillers, some start with one. Before you know it, the one is not effective anymore. You have to add second one, and some come to our clinic with bags of drugs they are taking. What all these drugs have been doing all these years is to suppress the symptom of pain, but not treating what causes the pain. And the danger of it is that most of these painkillers cause a lot of side effects, like peptic ulcer disease in the stomach, kidney problem, heart problem, and all manner of problems when you take them for such a long time. So instead of using painkillers to suppress your pain, find out what is causing the pain and nip it at the bud. For you to solve what is causing the pain, you need to find out what it is. So it is a grave error for people to be treating their joint pain without a diagnosis to find out what's going on. When people call in, I'll ask them, for how long have you been having this joint pain? Some will say 2 years, some 3 years, some 4 years. And the follow-up question will be, have you done any tests like X-ray, MRI, or CT scan to find out what is causing the pain? And they will say no. And what comes to my mind is, then what have you been treating all this while? Actually, what they have been treating has been pain and not the cause of the pain. So for you to solve your chronic joint pain, please, you need to do an imaging test. What the imaging test does is to find out what has damaged in the joint that is responsible for the pain. At what degree is it? So if your doctor cannot repair or will give you a treatment that will not repair what has damaged in your joint, it means that he doesn't have solution to your pain. So imaging is very important for the proper diagnosis of the cause of the pain in your joint. Okay? Many of us have this common practice of listening to people. In fact, in this part of the world, almost everybody is a doctor because everybody can recommend. Everybody can prescribe. This is what I took and I became fine. Go and buy it. Forgetting the fact that we are not all the same. So instead of listening to your landlord, listening to your co-tenant, listening to your co-worker, you need to listen to the experts. When it comes to health, the health practitioners are the experts. And not all each health practitioner has his own area or specialty. So look for the experts to recommend to you what to do. So some of us buy from the hawkers, some of us buy from those who advertise in the motor parks, some of us buy from those who advertise in the bus, some are buy from those who advertise online on Facebook, and some are buy from all sorts of people without finding out whether those people selling those drugs are doctors or whether they are experts. So meet a doctor who is trained in that condition to solve your problem. Okay? Now, this is a very wrong thing to do. You come back from work, you are having back pain, you tell your kids to climb onto your back and stomp on your back. And some will claim, yeah, after such a thing, I feel relieved. Yes, you felt relieved because that exercise, what it did was to relax the tensed muscle at your back. But just as I said earlier on, the tense muscle or the pain is not the problem. The degeneration of your spine in this condition is the problem. And another problem with this is that depending on the size of your child or how aggressive they are, they can snap your spine and cause more problems. So the more you do this, the more you put your spine in danger. This is a very wrong thing to do. Okay? It's very, very important. If you can make a diagnosis of any health condition early enough, you stand a very high chance of solving that problem permanently. But unfortunately, many of us seek for the experts' treatments when they have tried all sorts of things and it didn't work. The trajectory people usually take is they go to the nearby chemist to buy drug. They have been buying drug for months and it's not working. Maybe they will think it's diabolic influence and they go to prayer house. To pray is fine. But at the end of the day, at the late stage of the problem, they now come to see the doctor. At this point, most times there's nothing the doctor can do. Because even if he treats this, it cannot revert the condition back to normal. Arthritis goes from stage 0 to stage 4. So this person has had a deformed knee. This is at stage 4. There's nothing regenerative therapy can do at this point. This person might have to do surgery or knee replacement surgery to solve this problem. But if one had presented earlier on with simple regenerative therapy, the joint can be restored back to normal. Unfortunately, people don't like to go early to the hospital because they think, it's something I can manage. I don't have the money to spend. The doctor will make a crazy diagnosis so that he can reap the money from me. All kinds of excuses. But at the end of the day, when it becomes complicated, one spends even more at this point and might not even solve the problem at this point. Okay? Some of us have this common practice inviting these local people. They use blade, sometimes dirty blade, or one they are using on some people, they use it again on you to cut your skin around the joint. Some do it at the low back or any joint that have been having chronic joint pain, claiming that they are removing dirty blood. They say it's dirty blood that is causing the chronic pain. That is wrong. There's nothing like dirty blood causing chronic joint pain. Yes, you might have trauma, somebody might fall or have trauma and have bleeding inside the joint. That is because of trauma and not because accumulation of bad blood is what caused your chronic joint pain. So this practice of cutting or letting out blood is wrong. It doesn't work. It used to be an olden days practice for certain health conditions, but some have narrowed it down to chronic joint pain. Is a very, very wrong practice. It doesn't work. Okay? Yeah, steroid injection into the joint. Steroid is a very potent painkiller. It works for some, it fails. The efficiency is from 0 to 100. So potent painkiller, it can give you pain-free period of weeks, months, but when you repeatedly take this injection, the side effect is that it now encourages further degeneration of the joint. So people that take this steroid injection for a long time will finally come down with severe degeneration of their ligaments and cartilages. So if you are going to treat joint pain, don't just mask the pain, which is what steroid does. Find out the degeneration and repair it. So taking steroid injection for many times is wrong. Okay? Many of us might not know, because some people still call in and say, do you say arthritis has a cure? Yeah, it has a cure, but with a caveat. Now, we have understood that pain is not the problem, but the degeneration in the joint is what causes the pain. Degeneration is destruction of joint tissues like ligaments and cartilages, capsules, bursae, all those structures in the joint. When there is wear and tear, which is what degeneration means, and they are damaging and destroying, they shower pain, they cause pain. And the best way to heal that degeneration is what is called regenerative therapy. And PRP, which stands for platelet-rich plasma, is one of such regenerative therapy. Platelet is one of the cells in our blood. So this PRP is from the patient. So you take the patient's blood to produce this. Okay? Sorry. You take the patient's blood to produce this. Okay? So when you inject it, the yellow fluid you're seeing here is the plasma, which is the liquid part of the blood. It will be absorbed. And it contains some nutrients which it will also supply to the joint to heal it. But the most important thing is the platelet cell inside this cell plasma. When it goes into the joint, it will burst and release the growth factors, which will begin to regrow the damaged ligaments and cartilages. So if you are having chronic joint pain and you have not done PRP or prolozone or cold laser as regenerative therapy, you are making a grave mistake. So these are the mistakes people make. You watching me might be making one of these mistakes we mentioned. Therefore, if you want to solve your chronic joint pain, go for regenerative therapy. That is the solution for arthritis. Thank you for watching. See you again in our next lecture.